Hello and welcome back to the podcast. As some of you might have noticed, I have been away and I took a little break. There will be a few episodes coming up on this actually where I will take you through what's been happening in our life as a family, and I will also update you on my pregnancy as well. But for today, I am chatting with the lovely Ebony. Ebony is a mum of two beautiful girls, and she takes us through her two very different pregnancies, birth, and especially postpartum. From experiencing hyperemesis gravidarum very early on in her pregnancy to then having preeclampsia in the later stage of her third trimester, and then experience a lot of miscommunication or a lack of communication from the hospital, Ebony takes us through her very first pregnancy and labor, which then ended with both Ebony and her baby girl having an infection. And this was the start to a very rough journey of motherhood for Ebony. From there on, Ebony takes us through the issues she had trying to establish breastfeeding while recovering from an infection, and also experiencing low milk supply because she had a postpartum hemorrhage after the delivery of her baby girl. Something really important that we chat about during this episode is the societal expectations and opinions that others have on new mums, and how as a first-time mum it is sometimes really difficult to not listen and essentially do your own thing. And this is the main difference in Ebony's postpartum between her first and second girl. You will hear how in her second postpartum, Ebony just decided to do what she felt was the best for her babies, and she felt a lot more relaxed and easygoing with her parenting compared to her first postpartum. And finally, during this episode, we chat about something that I am very passionate about, maternal mental health, and Ebony shares with us her diagnosis of postpartum depression, how this journey has been for her, and she also shares with us some really helpful strategies, and she also shares how she now views parenthood and the parenting load from a different perspective. I thought that was very interesting, and I hope you enjoyed this episode as much as I did. You are listening to Kappa with a Doula. I'm your host, Alicia, exercise physiologist and doula. And every week I chat with a mum or mum-to-be about all things pregnancy, birth, and parenting. The stories you will hear in this podcast are real and sometimes raw, but they are all told without any taboo. So grab yourself a cuppa, put your earphones in, relax, and enjoy this episode. Hi, Ebony. Thank you so much for coming on the podcast today.
You're most welcome. Thanks for having me.
No worries. Do you want to start by introducing yourself? So telling the listeners your name, where you're living, and who is in your family.
Yeah, obviously I'm Ebony. I live on the Sunshine Coast here in Queensland, and I live with my wonderful husband, and we have two daughters, Grace and Louise, and they're 2.5 and 1.
Amazing. And so, Ebony, did you always want to be a mum?
I think I did. Our first was not planned, so it kind of was almost sprung upon us. I was at a point though where it's like, oh, okay, you know, we're engaged and I'm 29 at this point and my husband's a little bit older than I am. So it was like the right kind of timing. So yeah, kind of just fell into motherhood, and I kind of haven't looked back. Sometimes I'm like, oh goodness, but never regret it.
Did you ever discuss it with your fiance back then and husband now that you both wanted to have kids at some point?
Oh, when we first met, my husband told me that he's never getting married and he's never having children. So, complete 360 now. Yeah, his mind has changed, so...
Any particular reasons for refusing marriage and kids, or just that's how it was?
I just think he had this perceived, I guess, perception that like a wife is kind of controlling, and he's big into motorbikes. So, you know, you can never have time then to go out motorbike riding if you have a wife and children, and it sucks all the joy out of your life. But obviously, as he's come to find, it's the complete, I mean, it sucks a little bit of joy, let's be honest.
Yeah.
But, I mean, they provide so much more in terms of other things. So, I was going to say, I've read back a couple of the messages that we sent between each other when we first started dating. And I've asked him, do these kind of reflect how you feel now? And he just laughed so hard. And he was like, oh my goodness, I was such an idiot in what I was saying. So, yeah, it's funny to look back.
It is. Yeah, I mean, you know, things change, circumstances change, and you can change your mind and decide that the life you thought you wanted is not the life you want now.
Exactly.
That's normal. So how did you find out you were pregnant with your first, because it wasn't a planned pregnancy?
So we actually were engaged, well, we became engaged probably just over 2 weeks prior. So I think we got a little bit too celebratory, if you want to call it. And then it was Christmas Day. So the way that I don't take birth control, so, and I've kind of tried it, it never kind of worked for me. So the method we were using was tracking my ovulation cycle, and that had worked for a pretty long time, and obviously until we had that one little lapse. And so I was buying kits basically that included like ovulation tests so that I can keep a track of it, and they always came with a couple of pregnancy tests. And so Christmas Day, I'm like, oh wow, I feel a bit off, I'll just take a test just to be sure. So it was in the evening, and then I had a shower and I came back out, and there it was, a big a positive pregnancy test. So I went into my husband, my fiance at this point, and I was like, look at this, like, I'm pregnant. Oh my God, what are we going to do? And he goes, right. And then he went to sleep. He just went to sleep. Like, he was so unfazed by the whole thing. And I was like, I'm like, because I'm in uni, what am I going to do? Like, can we incorporate this into our life? Like, oh my goodness, what a big shock, but also an exciting. I was excited. And my husband was just so unfazed by it all. But yeah, that's how we found out.
Right. Wow. So it's basically you've got a full-on life, and it's not planned, and then it's thrown at you, you're pregnant, and then you're obviously thinking about it all, going, oh, how is this going to work? And your husband is fine. That's great.
Yeah, I think it was just in a bit of shock as well, and that's just how he kind of copes with it. He's like, oh, okay, let me just sit and digest this for a little bit.
Yeah. Wow. So, I love it when, well, at least your husband wasn't stressed, because if you're both stressed, that increases your stress, obviously. But if he's not stressed, then I feel like maybe it helps you to be less stressed, maybe. I don't know, sometimes.
Yeah, it was probably a good reaction to have, because then I wasn't, like you said, I wasn't then compounding on my stress even more and taking his stress into the equation. Like, I was just,
Yeah, no, that's right. So you find out you're pregnant. Do you know anything about, what you do when you find out you're pregnant? Do you know what type of care you want and all of that, or is this all completely new to you?
This is all completely new to me. So I went and booked a doctor's appointment and had a blood test. It came back that I was still really early, so about 5 weeks, and we went and had a scan booked. So it was just about, I think I was 5.5 weeks at this point. And I just started researching, of course, as you do, absolutely everything. So yeah, I just was asking so many questions to my sisters. I have older sisters, so my sisters are 20-ish years older than me and have already had their babies who have grown up. They're adults now. So I was asking them lots of questions like, what do I do? What do I expect? What happens now? And just going about it that way.
Yeah, good.
I remember going back to my GP about 6 weeks and said, I can't keep anything down. I'm so sick. And she was a bit really dismissive of it and said, you're only 6 weeks. It's still too early to have like morning sickness. You'll be fine. It's just, you know, you're feeling off. And it continued and it got worse and worse and worse. And when I was about, I think 7 weeks along, I said to my partner, I can't do this anymore. I'm so sick. I ended up calling the non-emergency line and the nurse on the line said, you need to go to hospital. You're so, like, if you can't keep anything down, you're so dehydrated by the sounds, you need to present to hospital. So I went there and I was diagnosed with, I can never pronounce it, hyperemesis gravidarum, if that's how you say it?
Gravidarum.
Gravidarum, there we go. I just call it HG.
So, for easy. Yeah, easy.
Yeah. So diagnosed with HG.
Right.
And then I had a nurse. They discharged me to hospital in the home care, which was amazing. So I had a nurse come out twice a day for 2 weeks to put anti-nausea medication and fluids through a drip that I had, which was good, but I still had to go to work and do uni on top of all this. So
with an IV?
So work were really, I was in a different job at this point. And they were really kind of just so not understanding of it, which was really hard. I felt like until my managers now have both gone on to have children of their own and experience morning sickness. But I just don't think they understood like how bad it can be. So I just, my nurse made a little, I guess a little sock that went over it was in my hand, the drip. So I just put a little sock over my drip, on my cannula, and I got on with my day. So she'd come in the morning before work and I'd have my anti-nausea medication, and then she'd make sure I'd have something to eat, and then put the bag of fluids through. And my goodness, what a bag of fluids can do. I felt like $1 million at that point. So and then she'd come back in the evening, and that happened for about 2 weeks until I kind of was feeling a lot better, and then I was on medication after that for a few more weeks until about, I think, 20 weeks it kind of subsided.
Wow, 20.
Yeah, and then it came back late in my pregnancy, so it returned about 32 weeks.
Oh. So you got 3 months of rest, and that was it.
Yeah, and then it was back again. So I remember trying to like check out at Coles and buy groceries, and I'd be vomiting, and I remember I was at uni running out of labs and vomiting all over the lawn. You know, having to pull over in the car and vomit, and it's just everywhere all the time. It was terrible. I don't wish it upon anyone.
No.
That it was just, it wasn't, that was probably the worst thing associated with pregnancy. Just, and that constant feeling of being nauseous and not knowing, like, where you're going to be sick, and having to keep changes of clothes with me everywhere I went.
Oh, gosh.
Yeah, it wasn't fun.
No, and the thing with HG, I've been, with this podcast, what I'm finding is some medical professionals, like, whether it's your GP or it's, it's a doctor that works in the emergency department, some of them, they have no idea what HG is. So they go, oh, you're pregnant. Well, that's normal that you're sick. But we know that HG is beyond normal sickness. Like, we know it's just vomiting that will make you dehydrated. You can't keep fluid. You can't keep food down. And that's not good for anyone, really. And if if the person had gastro and wasn't able to keep anything down, then the doctor would go, oh, well, you need an IV, you need to be rehydrated. but because you're pregnant, they go, oh, well, it's normal, but it's not. And that's so good that that ER nurse was on top of it, because otherwise you could have gone weeks without getting the treatment you needed, actually.
Yeah, I'm so lucky that the hospital here took me seriously. Like, I was in overnight, I was given bag after bag of fluid. I'm so glad that they took me seriously, because it could have gone, like you mentioned, the other way.
Yeah, and that's terrible that you know, like you said, oh, I was taken seriously. How could you not be taken seriously? Like, you're a grown-up who shows up to hospital and you're stating, I'm dehydrated, I can't keep anything down. Who is the doctor that's going to go, oh, well, it's just pregnancy? Like, that's just wrong. Like, if a woman says, I'm dehydrated, I need IV, we know that a patient will usually tell you what they need. They will give you the diagnosis. You literally just need to listen and not say, oh, it's because of this, it's normal. No.
Yeah.
So outside of HG, how was your pregnancy? Was it okay?
It was okay. I I did have high blood pressure on and off throughout the last trimester of my pregnancy. I do have a family history, so my mum and both my sisters had preeclampsia during their pregnancies. My GP, I had a appointment with my GP at one point, and she took my blood pressure and it was so high, and she was like, I'm calling the hospital, I'm sending you over right now. So she called the hospital. They said, she's like, they'll probably induce you. I think I was 29 weeks at this point. 39 weeks, sorry, at this point. So, like, you know, like, well within that kind of safe realm to deliver a healthy baby. And they said, oh, no, when I got there, and they did some obs. And a blood test, they said, no, you're fine, go home.
Oh, okay.
So like, oh, okay. And then I had a few kind of back and forth stays in the day unit there and the maternity ward, just to be monitored for my blood pressure, and then taking, you know, urine samples and then blood tests to see where I'm at. And as I've said to you before, it wasn't until I presented in early labour and I had high blood pressure again that they took bloods, and they've discovered that I in fact did have preeclampsia. So took a while, but we got there. Yeah,
and it's funny because you also had the family history, so it sounds like maybe you needed maybe a bit closer watch to, like, which I mean they did, but then they somehow discovered it almost a bit late, I feel, but maybe that's how it was.
Yeah, it wasn't, like I said, until I was in labour and at hospital that they discovered it. So I was like, I come in so many other times and it was never kind of acted upon. Yeah. So a little bit disappointing in some ways, but also I can't change it, unfortunately.
Yeah.
I think too, now I didn't discover this until actually I was pregnant with my second, and I wasn't even informed of it. My student midwife came and told me, but when I presented in labour with my first, I was actually sick. They knew that I was sick, so I had an infection, and they never told me that, and I never knew that until I was out with my second. So I heard that.
Why would they not tell you?
I think they wanted to just make sure that I wasn't, because I have a history of anxiety. So I think they were trying to, I guess, keep me safe in not telling me, so I didn't have a reaction, to it that would make me stress out a lot more. So I think in their minds it was better to withhold it and not let me know than to tell me, hey, this is what's going on, and make me stress out more, when in actual fact not telling me things is what stresses me out more and more. So with my labour with my first, the lack of communication seems to be an ongoing theme. So I had presented in labour. I was due for an induction, but when they checked, I was already 3 centimetres dilated, so there was no point for the balloon catheter. They were going to send me home, but then they realised that, oh, you have preeclampsia. We'll keep you, but we don't have room. Yeah, we don't have room for you in the birthing suite, so we'll send you to maternity ward. So I laboured there for, that was about maybe 8, 9 o'clock in the evening, and I was there until 4:30 in the morning, just labouring on and off. Like I said to you earlier, I was having contractions about every 5 minutes. lasting for a full minute. They were extremely painful. To me, that was obviously my pain threshold. Then the midwife in the maternity ward was very, I feel almost rude. And she's like, no, you need to lay down so I can time your contractions. And she was timing that had slowed down to 10 minutes when I lay down. And I was asking for pain relief. And she says, no, you don't need it. You're still only every 10 minutes. You're still in early labor. I'm not going to give you any pain relief. And then I was, I think, making a lot of noise, like in the shower. So I was in the shower, labouring, and she come in, she goes, I'm moving you to birth suite now. And I'm like, oh, okay, great. So a student midwife come in, took me over to birth suite, and straight away they're like, what kind of pain relief can I get you? I've heard you want pain relief. And I said, give me everything. And she goes, I can't act upon that. You need to tell me exactly what you need. And I said, I want an epidural. So she's like, okay, we'll book it. What can I offer you in the meantime? We have gas available. And I said, yes, I'd love the gas. I need something. So started on the gas. It was amazing. Doesn't take the pain away, but it kind of takes your mind off of it. I was the Little Mermaid there for a while. And then I was having Christmas dinner with Snoopy. So I was having a ball of a time while on this gas.
Cool.
I think the best thing was I thought I only waited half an hour to get the epidural, but my husband tells me, no, I waited 3 hours. So
no way.
3 hours. So he was very busy. So he had just started his shift, and he obviously had a few jobs before lined up before he could get to come in and see me. But luckily I only thought it was half an hour, but no. So
good.
That's one of the good things, I guess, about the gas. And then they
that and
checked
Snoopy.
me. I don't know. I don't watch Snoopy, so I don't know why Snoopy came to mind. And at one point, I started screaming, and my husband was like, is it contractions? Are you okay? Is it painful? And I said, no, there's monsters here. So I was, the midwife was like, I'm going to turn down the gas now, I think. So she ended up turning it down a little bit. So I was very happy at, that point, I think.
Right.
So then...
That's amazing.
Yeah. So after that, after I had the epidural, they're like, okay, cool. No, so now we can, if you want, we can check you and see how things are going. And obviously they attached the constant monitoring on Bub. So they had noticed that after contractions she wasn't recuperating, if that's the word, like recovering really well. Her heartbeat wasn't kind of getting back up there. So they're like, we might attach a fetal monitor onto her head. So I'm like, yep, cool, whatever you need to do, like make sure she's safe, that's fine. So they had done that, and they said to me a little while later, hey, look, it's still not looking like she's recovering really well after these contractions. We're going to get the obstetrician to come in and take a look. This was about probably 11 in the morning, and the obstetrician then didn't come in until 5 o'clock in the afternoon. And this whole time I'm stressing out, thinking, no one's coming in to check my baby's stressing out, what's happening? Because they said to me, if the OB says that Bub's in distress, we'll call for an emergency cesarean, and then it's go. Like, you'll have your baby within 10 minutes once they make the call. But what I didn't know until afterwards was that a little while later, my Bub had gotten back to being okay and recovering after the contractions, but they never told me that. So again, this whole time, this lack of communication made me think that I waited hours to see an obstetrician, and this whole time my baby's in distress, when in fact she wasn't. She was doing okay, but later on she had gone back to being in distress again. So about just after 4, and then the OB came in not long after that and had a look and took a blood lactate sample, and it was just under the cusp of her calling it for an emergency cesarean. She goes, look, we're going to give you 2 more hours to birth. If you haven't had your baby within that time, we'll pretty much call it, because we can't let, by this point I'd already been in labour for 40 hours. Like, you're getting tired, there's risks associated obviously with having such a long labour, and Bub, obviously, like we have seen, is on and off getting stressed, so we can't keep letting this continue. But luckily an hour later I was like, I've got the feeling to push. So it was with my
Nice.
husband in the room. Yeah, my the midwife overseeing me had ducked out for a tea break, and my husband was like panicking. He's like, "You need to push!" Like he's thinking like it's gonna happen in like the next minute, and there's gonna be a baby that he has to deliver.
Yeah.
You know, like the movies. But I was like, because I had seen. Obviously, I'd educated myself a fair bit. I knew that this process could take a little while. So I was like, oh, yeah, no, it's fine. Just wait for her to come back in. And he's like running around like a headless chook. And he ran and found some random poor little student doctor. And he's like, oh, you have to push? And he's like, I don't know what to do. And they're both like freaking out. So luckily the midwife came back in, and then when it was time to push, a couple of other midwives came in, like the head midwife was there, and I was like, by this point my epidural had actually worn off, and my little one was facing the wrong way, so not feet first, but we were like back to back. So I had intense back labor, which was really painful, and it felt like at this point, obviously where she was sitting in my birth canal, it felt like my back was breaking, and I was like, I can't do this, I just can't do it, I can't push her out, it's just too painful. And the head midwife, I remember saying to me, why can't you do it? You can do it. And that was amazing. And I'm like, actually I can, like it's just keep pushing. So I managed to push her out. It took an hour, so I was within that 2 hour, I guess, period of being able to birth her. My goodness, the most painful thing I think I've ever endured in my entire life. But she came out all 4.2 kilos of her, so
Wow.
managed to have a nice big healthy baby. So she came up onto my chest, and I had delayed cord clamping and straight skin to skin, and I wanted to see if she could make her way and start to feed naturally without kind of me intervening with that. So but unfortunately none of that got to happen, like me feeding her like that, because I had a postpartum haemorrhage. So in total, I think what was written down was 1.7 litres, but I think the total was actually 2.2. So a massive blood loss. That was really scary. So the room filled with people, like I've never seen so many people come so fast into a room, because my husband actually they had my husband press the emergency button. And yeah, I remember laying there. They had taken the baby from me, and I'm getting drips put in everywhere. And this point, my veins were collapsing, so no drip was going in, and they're just having to do it again and again and again. And I have a massive fear of needles and blood, so I'm not like, I'm just laying there like, wow. And I look over at my husband, and he's just pale, and there's a nurse fanning him with a little towel on his head, and I'm like thinking, like, I'm dying here, like what are you doing? My goodness. But I think he was saying later on that seeing me like that, like he thought like this is it, like he's watching me die basically. But what had happened was, I think having a big baby, they had actually given me, to help move the labour along during labour, they had given me, I forget the drug that they give, like the synthetic hormones. They had administered that. So that, and then the fact that I had a long labour, my cervix just hadn't clamped down properly. So it was tied, it was just open. And that's why I was hemorrhaging. So luckily they were able to just give me a whole bunch of injections, and then my cervix decided to clamp down and stop the bleeding. And then that's when obviously I said I was sick with an infection. My infection took over. So my temperature spiked. I started shaking. And then they realised too then that Bub has an infection. So she had a fever as well. So she was raced off into neonatal. And then they started antibiotics for myself. So yeah, she ended up having a week-long stay in neonatal unit, so with getting antibiotics, which is just rough in itself with a little baby, like destroying all that good gut flora and all of that. So she ended up having really bad she was really colicky, a really colicky baby, especially after feeds and things like that. And I think that was associated with all the antibiotics she was given in that first week. And then I had antibiotics too, so it was coming through my breast milk. So, yeah, it was a bit of a rough start. to be honest, for all of us into my...
Sounds like it.
Yeah, my introduction to motherhood. So, yeah, being apart, not being able to, you know, share a room with her, and then I was sick and she was sick, and then obviously recovering from birth, and then I was in neonatal with her once I was discharged from the maternity ward. So kind of just thrusted out with this sick baby, and in a really kind of public setting too. So I mean, obviously there's some privacy there, but you don't have a decent bed, and then there's doctors and nurses and other mums there, and it's not really the best setting to be kind of getting, I guess, to know your baby and figure out your routine and find out like, okay, so how do I do any of this? Yeah, it was a really hard place, and I'm just I look back in a lot of ways I'm really lucky. Like I had a big, beautiful, healthy baby in the end, and it's hard because I guess a lot of mums who go into neonatal don't get to always leave with their babies, so I was really, really fortunate in that situation. Yeah.
Wow, that's that's a really rough start to motherhood, especially when it's your first experience at birthing, and it was a really long one. You had the hemorrhage afterwards, and then the infection for both of you. It's so rough. How did you cope when you both, all three of you got back home? How did you find, your marks and like finding, a routine? How did you go with feeding and that?
I was really lucky in that my daughter was an exceptional feeder. So she had an amazing latch. She fed really well. I had actually lost my milk supply due to the hemorrhage, so we ended up having to supplement with formula, and I was having to pump, feed around the clock, which was really draining and really hard mentally. I hate pumping. I think due to that experience, I hated it. I hated doing it. I don't enjoy it. I just hate pumping now. I can't express how much I despise pumping. And it was really hard. Like I said, she was a really colicky baby. She was really unsettled. And I think having a lot of these outside pressures too, like put your baby down, Dre's drowsy but awake. Don't feed your baby all the time. Don't use breastfeeding as a dummy. Don't pacify them that way. Like, you're giving them bad habits. My husband and I would hold her and like comfort her and jiggle her to go to sleep, and that's how we got her to sleep. We're spoiling our baby and things like that. And a lot of these comments and outside pressures, and then what you read on the internet, it was like, oh my goodness, like I was so stressed and felt like I was failing. I was completely failing. Of course, like feeding your baby to sleep, like it's the easiest way to get them to go to sleep, but thinking in my mind, like, this is so wrong, like I'm not meant to be doing this. It really set me up to almost fail in a way. So when in reality, that's completely normal. That's so good for them. There's nothing wrong with doing that.
No, that's it. And that's what I was going to say. I think, sorry, I just wanted to interrupt to say, whatever you're doing to get baby to feed, to settle, especially when they've got colic, and that's really hard to settle them, and then to sleep, whatever you're doing, that's what's right for your baby. And I think we, as a society, we think that when baby's born, they need to go in their own, cot or bassinet. They need to sleep on their own, unassisted. They need to be independent in a way. And we know that from, other cultures, like more, African and Middle Eastern cultures, that's not how they do things. They keep the baby with them, on them, feeling the skin of the mom or feeling the skin of, the dad for months. Because that's what the baby needs. The baby needs, touch, feel. They need to be held. They need to be close to their mom. They need to be close to the breast as well so they can feed. Like, without any schedule, without going, oh, it's only been an hour since they fed. No, they just feed when they feel hungry. And we know that those cultures, those babies are more settled than ours, who are meant to be straight out of the womb and independent and be, able to settle themselves and feed every 3 hours. That's not how it is.
Yeah, and that's it. Like being told, oh, only feed for 5 minutes every 3 hours. Like, my goodness, that's not that's not healthy, especially for a newborn. No, it's not long at all. No. So, I remember being told by the lactation consultant, feed 20 minutes on both sides, then pump for 20, and then go back and feed for 20 minutes a side again. So, I was doing that. I think this is why I hate pumping so much too. And then she'd come back again, 20 minutes later, and I had to do it all over again. So, to establish my supply, which in the end, thankfully, I got it up and I was able to breastfeed exclusively and take the formula away and then pump only when I needed to. So I was lucky in that respect that I was able to establish my supply. But like you said, there's such a big kind of westernized culture with babies in Australia, and it's so it's really hurtful. And it's really kind of, I'm trying to think of the word. I can't think of it. But this really kind of westernized approach. Right. It's so, it's just not helpful at all. And as you said before, more of this Eastern approach, it's so much better. So with my second, I just did whatever she needed me to do. I had some really good advice.
Correct.
That when you have a baby, everyone wishes they had a manual. But the baby is the manual. If they're crying and they need a feed, then just feed them. So that's it. Or put them to sleep if they're, if that's what they need, or feed them or sleep them or burp them. The baby's the manual. They'll tell you when there's something they need. And I just followed that approach with my second, and just the difference that I found with both of them. Yeah. My first is a little bit more anxious. And my second is so cruisy and just goes with everything, and she's such a calm baby and child. And I think the difference that me as a mum, being more confident in my approach and my style of parenting, is a big thing to do with that.
I think, as we said, the whole, you need to leave your baby to be independent. They need to be able to, settle on their own or sleep in their own room and their own cot. The other thing is, when you're a first-time mum, you take on this advice because you're like, oh, well, it comes from other mums, and I don't know anything much yet because I've just had my first, so I'll just take that advice on board and see. And then when it's not working for you, then you feel like you're failing, because it's like, oh, but it's working for other mums and it's not working for me, and I must be failing as a mum. No, every baby is different. Just like you said, you've got 2 girls, very different, very, very different personalities. And one thing that would settle one might not settle, the other one. And that's how it is. As you said, the baby is the manual. They will tell you what they need. Yes, sometimes it is really hard, because you're like, oh, do they need a change? Do they need a burp? Have they got colic? And when you've got colic in the equation, it's really hard. But other than that, they will tell you. And even if you think, oh, but I've just fed them, surely they're not hungry. Maybe it's not the hunger, maybe it's the sucking. Maybe they just need to suck and they need to be close to you, and that's all they need. Mm-hmm. And that's okay. If that's how it is, then so be it. Motherhood, and especially in the first 3 months, is a time for lots of skin to skin, lots of holding baby. And yes, there is a lot of contact naps, like when baby feeds and they fall asleep on you. But that's what they need, because they've been with you for 9 months and then they're separated. And that's a hard separation for them, to be away from their mom, from the warmth that they had. So they need that to be able to be in a new environment that's bright, that's got noise, that's just so different to where they were.
Yeah. This whole westernized approach to parenting is basically putting adult expectations onto babies, toddlers and children, and it's just not feasible.
Exactly.
So we did a lot of contact naps with my second, and I just embraced them. I bought a sling, like a wrap carrier with my second,
Yeah.
which I didn't have with my first, and that's how we got around, and that's how we did things, and then that's just how it was. And it was the best kind of time. Like, I wasn't stressing, and then she just went with the flow, and then I just kind of worked around that. You know, I found a good show, and I would sit down with, you know, a snack and let her rest, and it was good.
Amazing.
Yeah.
And we know that if mom is calm, mom is feeling good, then baby's going to feel that too. We know that. So if the mom is stressed because, oh, I need to, you know, they're falling asleep on me. Oh, but they need to be in their cot right now. Oh, no. And you know, and they can feel distressed. So if you're relaxed, you know, as you said, you've got your sling, they're contact napping on you, and you're just, you know, you've got water, you've got your show, you've got your phone, then happy days. And you know, the first 3 months, you need to recover. So you need a lot of rest, a lot of just not being on your feet, and you need that time to bond as well. You need to get to know your baby needs to get to know you, and you need that slow time. You know, I know in this day and age, we, you know, it's like we need to be busy, we need to be doing things, we need to be multitasking. But no, we don't actually. When it comes to early motherhood, no, we can just sit down, watch a show, have baby nap on us, and do nothing else than that, because we've just gone through birth, we've gone through a pregnancy. That's a lot of effort on the body, that's a lot of work. We need to recover now, and the baby needs to adapt. And that's the best way for you to recover and for baby to adapt. It's to just take it slow, you know, wear the baby, have baby on you, watch shows, read books, do something that will just, you know, lay in bed, relax, basically.
Yeah, this whole societal pressure that women need to keep going and work hard and do it all is so harmful, especially to new mums. Like, we should be celebrating women taking a break and enjoying this newborn stage and doing the contact naps and supporting them in that. So, yeah.
Exactly. And I think, you know, I'm going back to what I said before, that I think the Eastern, you know, cultures have so much to teach us, because they've been doing, you know, the whole baby wearing, what we call baby wearing. They've been, like, to them, that's normal. Like, it's probably not normal to not have your baby on you at all times when they're just born. So I feel like they've got so much to teach us, and they've been, you know, we talk about having a village, but they've always had a village. They've always had, you know, other moms around cooking for them, because the new mom, you know, shouldn't be cooking, she should be resting. So therefore, meals get delivered to her, and also other mums around, other, you know, aunties, grandmas will wear the baby so that the mum can get a little bit of rest as well. So I feel like they've got so much to teach us that we should just embrace, instead of going, oh no, I need to get back to work. Oh, I need to multitask. I need to clean the house. It's like, no, you don't. Those things can wait. You can just enjoy your baby, and the rest, you know, yes, you need to be fed. That's important. But again, we've got meal delivery services. We've got, you know, maybe the husband, the partner can cook. Maybe some people have family around. Maybe the family can bring a meal. Maybe there are options, but I feel like we don't ask for help. We have to do it all ourselves. And I think that's where we've gone wrong, actually. We need to be asking for help. We need to be, you know, delegating tasks so that we can be just enjoying the baby.
Yeah, I think asking for help in our society is a sign of weakness, when it should be seen as a sign of strength. Yeah. Like, being able to pinpoint where you need help. Like, what a amazing ability to be able to stop and ask. When I was pregnant with my first, I had a really good strategy in place to be able to ask for help without seeming like a burden to others, because that was my problem. That's the thing I had issue with, was to put a list of things that I needed to get done and put it on the fridge. So, cook dinner, vacuum the house, hang out laundry. And if ever the question came up when people visited, like, can I help you with anything? Because sometimes that question is like really hard to answer. Like, oh, no, don't do anything.
Yeah.
And you don't want to burden with someone with something that they don't feel comfortable doing either. Is, oh, there's a list on the fridge. Can you just pick one of those and help me with that? And that way they're able to pick something that they feel they're capable of doing and can help with. And it's helping you, and it's taking a lot of, I guess, the hard part out of being like thinking of something and asking someone to do it. And then I guess that almost that rejection of like, oh no, I can't help you with cooking dinner. I don't know what to cook for you. You know, like if they don't feel confident cooking dinner for you, they can at least hang out some laundry or vacuum the floor. And I found that was a really good tactic.
That's a great great thing. Actually, I've never heard that, and I think that's a great thing because, as you said, sometimes friends come over and like either you can't think of anything for them to do, or you just don't really want to ask, and you also, when they say, "Can I help?" you also don't want to potentially unravel the whole to-do list as well. Because you're like, oh, maybe that's too much. So yeah, I think that's a great idea actually. And as you said, they pick one, and there's no pressure to, I don't know, maybe cooking dinner is harder than doing the dishes, and there's no pressure to go, oh, they've picked the easy task. Like it's none of that. It's just like the one thing you do for me will greatly help me, no matter what it is. It will greatly help me and contribute to me not feeling like I have to do it, or not putting pressure on myself to go, okay, I'm not feeling up for it, but I have to vacuum the floor. And then you do it anyway. Did you have a lot of support in your postpartum? Did you have family, friends coming over to help you?
Yeah, I'm really lucky in that. Well, first of all, I have a really good husband. Like, he's very hands-on. So, he changes the nappies. He gets up during the night. So, I'm really lucky in that aspect. He doesn't cook dinner. I mean, he tries. But let's be honest, he just goes and gets Maccas. So, I mean, that's something.
Oh, yeah. No, that's good too. I mean, that's a skill to get, Maccas.
And then
but I mean, I just wanted to interrupt and say I read something the other day about something in terms of the wording, right? So we say, oh, my husband helps me to change nappies, to change the baby, to do bath time, whatever. And I feel like it shouldn't be, we shouldn't say, oh, the husband helps me, because you're a team. You and your husband, you're a team. You're both the parents. Sharing tasks it should be normal. I feel, maybe that's my opinion.
100%.
Sharing load in as much as you can. I mean, obviously your husband can't breastfeed. That's pretty obvious. But he can, as you said, he can change the nappies, and he can do, he can do bedtime. He can wake up through the night. He can't cook. That's okay. Maybe he can do something else that, that helps you to take something off your plate, so then you can cook when you feel ready for it. So sorry, just wanted to say that.
Yeah, no, I completely where you're getting from, and it annoys me when, I know I said that he helps, but he parents his own children, but it annoys me when people say, oh, he's babysitting today. I'm like, well, he's not babysitting. I'm not paying him. He's parenting his own children.
Yeah, that makes sense, yes.
Yeah.
Yeah, it's his responsibility too, yes.
Yeah. But it's good. We kind of have a bit of a setup here at home where we each been delegated a task. So he does the dishes in our house, and he takes out the rubbish, and he does our lawn care and looks after our vehicles, and I do other things. So my tasks are I do the laundry, and I do vacuuming. So it's kind of like, okay, you do this and I do that, and that's each of our responsibilities, so it doesn't all fall on one of us. Sharing. Yeah, so it's kind of helped our household kind of move through everything. So that's been a really good implementation for us. But I'm lucky because I have support in my older sister. She comes at the drop of a hat some days. She lives 3 hours away, but she's always there. She's a really good...
Wow.
Yeah, she's really good at, if I call her upset over something, like my daughter won't get dressed for daycare and I'm struggling and she's having a really hard morning. She's like, it's normal. we've all been there. Just
Yep.
send her with some spare clothes and some jammies, like, send her in her jammies, you know, like, if she's not going to get dressed for the day,
Yep.
like, it doesn't matter that she's in her pajamas, you know, it's
Yep.
not going to, it's
Exactly,
not like
that's right.
a life or death situation. So she's been really good at kind of just bringing me back into the moment and understanding that all of these things are normal, and almost pretty much every mother has been through it. So that's really good. And then I also have a really supportive mother-in-law. So again, like, she came over the other morning and she started cleaning, and I have to let go of that, like, thinking it's a bad thing, but seeing as, oh, she's helping us and helping our house. And again, our house is moving forward because she's helping do a task that I'm too busy to do at the moment. So she's been really good too. So she takes our little ones, and she jumps in wherever we need her to. So I'm really fortunate in that, and that's how I can do uni and work and all of these other things that I have on the go, is because I've got this really good support network.
That's essential. As you said, you just need support, because otherwise you can't do it all. You're only one person. Your husband's only one person. You can't divide yourself to be in two places at once and do drop-offs and then be on time at uni and work and then pick up, and then there's sickness. You can't. You just can't do it.
No, it's definitely not manageable to do it all without the right support. And that includes daycare. So both my little ones go to daycare, and that is an absolute godsend. I love daycare, so I'm kind of excited on the days that they go. Sometimes I'm like, oh, thank goodness, it's a daycare day.
Because you would get some, yourself time to do. Maybe you're going to uni or you're going to work, but at least you're not a mum on that day, and you don't have the responsibility of your children. You can just park that and do something else. Yeah,
exactly. Like, it's using my mind for something other than being a mum and focusing on mum things. As much as I do enjoy that and I love my children to no end, it's good to kind of have a part of my life that's doing something. I mean, uni and the word enjoy don't exactly go hand in hand. I don't exactly enjoy uni. It's hard, but it's less hard sometimes than taking care of kids. So love that. But it's putting myself towards something that's going to benefit me. Hopefully, we'll see, in the long run. And that's what I like it for. So, yeah.
And so let's jump into time. How did you come to wanting to expand the family? How was that? Was it a planned pregnancy for your second?
We like to use the term we were trying without trying. So again, I wasn't on any kind of birth control when we fell pregnant with my second, and that's been a choice that still now I stand by. I don't like it. I don't want to use it. But my daughter was 9 months at this point. Just younger than 9 months, probably about 7 months old. And we kind of decided, hey, we're actually kind of enjoying this. She was in a really good spot from about 6 months onwards, where she was an absolute delight of a child. And then she hit toddlerdom. And we thought, you know what, let's take a crack at a second. So again, I wasn't tracking anything. I was still breastfeeding at this point, so my periods were all over the place. I didn't know exactly when I was ovulating and not ovulating. But my period was about 2 weeks late. But I thought, it could be because I'm breastfeeding still. It's all out of whack. But I took a test anyway. Came back positive. I think we were getting married at this point. So I think our wedding was in like 2 weeks. And we threw this in. And my husband, I remember him just being so ecstatic, and I was in just disbelief, because obviously it had happened. Obviously we were aware of what we were, kind of doing, but the fact that it happened so quickly was a bit of a shock, I think. So that was exciting. So it's nice to look back now on our wedding photos, and we have our daughter, and then obviously I'm pregnant in them, but no one knew at that point. So, except my sister. My sister was, my sister and my friend Carly were the only ones who knew. So at the wedding, I was drinking non-alcoholic wine, and to make it seem like, no one would pick up anything. So yeah, and then all of a sudden my daughter was 1 and I was pregnant, and I was like, oh my goodness, I have a toddler now and they are wild. What have I done? This whole 2 under 2 is going to be absolutely crazy. Because like I said, when we made our decision, she was quite more subdued as a child, and then all of a sudden she hit toddler doom, and I was like, oh my goodness, this is a lot. Toddlers are wild. And they're just wild beasts. Oh my goodness, aren't they just? So yeah, we had that. My 2 are 18 months apart. Where my youngest has just turned 1 this month, so I'm kind of seeing the light at the end of the tunnel now, this whole 2 under 2, but we'll see. She's starting tantrums now, so I'm going to have 2 tantruming children, so that will be fun to see how we navigate that. But like I said earlier, she's completely different, and I kind of attribute that to how I was with her as a newborn and basically her entire life, how I kind of dealt with her so differently, with what my expectations of her have been different. And now obviously my expectations of my oldest is a lot different too. So like I said, I don't have adult expectations on my children at all. Like I have expectation of a 2-year-old and expectation of a 1-year-old now. So but she's such a different little girl, and it's amazing to see her personality now come out. So, and she's so chill. She's such a chill little baby. So odd tantrum here and there, but nothing like what her sister was at 1. So
wow.
Yeah, it's been a bit of adjustment.
Yeah. How did you find your first was when you were pregnant? Did you feel like she felt that you were that you were busy? Like, because I don't know if you understand what I mean, but when you're pregnant, you know, they can understand that some of the focus is not on them, I feel, and then that can lead to a bit of, you know, lack of attention type thing.
I don't know. I was doing uni full time, so obviously I was really busy already, and she obviously then became really attached to my husband. So her and my husband formed a really, really good bond, which kind of made me a little bit sad that because I was doing uni full time and I was pregnant with our second, that I didn't get to spend that time with her. And now I feel I'm kind of like out of the picture a little bit. And we stopped breastfeeding at 9 months as well. She kind of weaned herself off. So I was feeling a little bit kind of sad, but obviously now as time's gone on, we have a really good relationship now, which I'm really grateful for. But no, she didn't seem to be too impacted until the baby came. I remember when we introduced her to her little sister, she was like, oh, what is this? Like, take it away. She wasn't too interested in it until obviously like when my husband went back to work after a month off, and it was just the 3 of us together, and obviously like I was breastfeeding and I couldn't quite play and interact with her the same as I would, or I would be holding the baby and she'd get jealous because then she wanted to be picked up. So it wasn't until that time that she kind of realized, oh, I'm not the center of attention anymore. And it's taken a little bit of adjustment now. She's becoming better now, but still has these moments where she gets a little bit of jealousy, which is typical. Like, that's of course going to be so normal, and I can completely understand why she feels that way. But I just try and integrate. Like, sometimes I would put my youngest down and she'd cry and be like, oh, sorry, Lulu, like, I need to spend some time with Grace now, and kind of do the same thing to both of them so she would hear me. And that really, really helped, I found. But yeah, it's kind of taken to about this point now to kind of level all of those feelings out and her not be so, I guess, angry towards her little sister.
That's a hard one, isn't it? And as you said, you know, different personalities as well. So it's hard. And I think, you know, obviously when you're not the only child anymore, and at, you know, 2, it's hard to understand the concept of dividing attention, but still obviously like still being there for her, but not like sometimes, as you said, you're feeding so you can't play or you can't pick her up because you've already got the baby. That's hard to understand, but I think they get it, and it's you know, in as much as you can explain it to a 2-year-old, that's what's got to be done as well. It's trying to explain with words and trying to spend time and trying to involve them. I think that helps, so they still feel like they're in the picture, obviously. Like, obviously they are.
Yeah. It's kind of taken to about now, like I said, for her to grasp the concept that the amount of tension they're receiving isn't equal to the amount of love that they're getting. So she knows that I still love her, even though her little sister needs a little bit more attention. Yeah. So she's kind of starting to grasp that concept now, which is really good. It's helping a lot.
Yeah, no, it would be. And as you said, 2.5, I think they've got more understanding too. And then 1-year-olds, that's when they're starting to gain independence. They want to walk. They kind of want to explore. So they also detach a little bit from you in that sense. So you get a little bit more time to be with your 2.5 and to still watch your 1-year-old who might be getting into trouble as well.
Yeah, they like to play together now. So my youngest is always looking for her sister, and where is she? And she wants to play. And sometimes they play nice, but sometimes they get a little bit as siblings do.
Yeah, that's pretty normal, I think. How was the pregnancy? So you obviously had a toddler and you were pregnant. How was that? And you had uni. Wow.
Yeah, I was doing uni full time. My goodness. But surprisingly, my best semester of uni ever. So maybe the pressure was a good thing. I don't know how I managed that. Doing a lot of science too is really hard. But anyway, I don't know. I think when I was in this kind of season of life, I was prioritizing sleep a lot more.
Yeah.
So I think that really ultimately helped me with my mental health and keeping focused and not losing my mind. And again, I was really sick with my pregnancy, with my second. I was diagnosed with HG again, but it was so less severe than it was with my first. So if it was a true diagnosis, then they've just diagnosed me because I've already had it. I don't know, but it wasn't as bad. Thank goodness. And then with my pregnancy, I had a student midwife this time around, which was amazing.
Cool.
We're still really good friends, and I'm so thankful to have her in my life and thankful to have her throughout that pregnancy and my labor experience. And then towards the end, I was like, I don't feel well. I was monitoring my blood pressure because, again, I had a few instances where it was a little bit high. And then went in one night for monitoring, and they were like, yep, you've got preeclampsia. You can either stay here the night and then we'll induce you, but pretty much, or you can go home, but pretty much we'll induce you by, this was a Wednesday, and they said we'll pretty much induce you by the weekend. I didn't want any kind of intervention this time, so I really didn't want to be induced or have a stretch and sweep done. But obviously the stretch and sweep versus being induced, I'd rather have a stretch and sweep to see if it induced labour. So had that done, went home the next morning at 5 a.m. I was in labour. So I was a bit like, I was a bit like, it'll be fine. It's going to take forever again. My sister was meant to join me for this labour, and I was on the phone to her having these contractions. She's like, because she couldn't make it in the end, and she was like, look, I think you need to go to the hospital. These are coming on pretty fast. And I was like, oh yeah, it'll be fine. And then my husband called the hospital because they told me to come back at 11 the next day to be induced. And it's in the morning, and my husband's like, oh, look, she's in labour. They're every 6 minutes. Do you want us to come in now, or do you want us to wait till 11? And the midwife was like, come in now. My goodness, why are you waiting? Come on in. This is your second. They're 6 minutes apart. My goodness. So we got in, and I was like, there's no way I can do this without an epidural. I just, no. So I had another epidural, but before that, they were checking how far dilated I was, and my waters broke while they were checking it. That was an experience and a half. My goodness. It just felt like one of those super soakers. Just into, it was wild. And I heard that there was some debate on whether it was like my waters broke naturally or whether it was artificial rupture because she was checking at the time. So I don't know what I don't know what they came up with in the end. But yeah, other than the preeclampsia, which was, I think it was a more severe case than my first, my birth was amazing. Like, I pushed her out in 5 minutes, not even 5 minutes, like less than 5 minutes. Took me 2 pushes.
Wow.
To birth her, which is amazing.
Yes.
And then, yeah, she was fine. She was healthy. I got my skin to skin, and then she made her way down and started feeding on her own, which is, I got that in the end. So my second was a really healing birth because I had a lot of anxiety coming into that birth with how my first went. So I feel kind of a sense of accomplishment in some ways. I wish I hadn't done it with the epidural, but I mean, there's no way.
It's painful. Yeah, it's painful.
Oh my goodness. Yeah. It's just a whole other world of pain. So yeah, there's no way. I don't think I could have done it.
How long was your labour this time?
I think in the end it was 14 hours. So
oh, wow.
I think it slowed down post the epidural.
Yeah.
Which is pretty standard, I think.
Yeah.
But yeah, going from 42 to 14, I'll take the 14.
Amazing.
Thank you very much.
Yeah, no, that's amazing. Great.
Yeah.
Wow.
So yeah, had her in the same day I started labouring. She was born that evening, and then like no complications. She was a good feeder, so she fed amazing. We still breastfeed now. She's 1, so I'm really happy to kind of be continuing that journey a little bit longer than when I did with my first. So yeah, like I said, she was such a really healing birth, and like I said, my approach to her, like, I would feed her all the time, and knowing that breastfeeding isn't just for food, it's for comfort and a whole other host of things. Yeah. Contact naps, and then I went back to uni when she was 8 weeks, but I took her with me, so I just put her in the carrier and along she came, and we pretty much attached to the hip. Yeah, she was just, I couldn't do that with my first, not at all, but with my second, because she was such a chill little baby, and I think I attribute that to how I was too. As a mum, like, I was really calm in my approach, that I had a really calm, happy baby.
Oh, see, that's amazing. And so now you're seeing the light at the end of the tunnel.
Yeah, the 202.
Yeah. Finally, you're out of it. Good.
Yeah.
How does that feel? Mentally, to have 2 children, obviously with very different needs and wants, and how is that with your life and everything?
Good. It's nice to find, I guess, a little bit of myself back again. I've kind of gone on a long journey, I guess, since I fell pregnant with my first. I was diagnosed recently back in January with postpartum depression, which has been a hard thing. They said that I was probably had it from my first, but it was never kind of picked up until now. So there's a long kind of struggle there to get to this point. But the changes now in my life, going back from where I was pretty much at my lowest in January to now, it's such a big kind of change. So yeah, it's nice now to kind of be on the other side of the 202 and then this mental health journey, and kind of see the light and be like, oh wow, like there is like, it doesn't last forever, like this whole where they're on you and they need you constantly, and all of that kind of fog that comes with the newborn stage. Like, it does kind of lift. It's nice. I like this side of life.
That's hard, and the fact that you had undiagnosed postpartum depression that wasn't picked up, that's really hard, because we know how important it is to screen mums for mental health, to check that they're doing okay, because postpartum depression, when you're not getting the help you need, that's really hard to navigate. And then obviously after that you've got a child, or you've got 2. That's really hard. Wow, good on you. Like, are you on medication? Are you getting therapy?
Yeah, so I take Lexapro now, so I'm on medication. So that's been an absolute game changer. Yeah, I was always failing, like, the mental health. I forget the test that they call it, but I was always doing quite bad in those. And the fact that it wasn't picked up until recently is a bit sad in a way.
Yeah.
But yeah, I see a counsellor every 2 weeks. And like I said, I take medication. I've been to see a psychiatrist. My GP is amazing.
Nice.
On this journey with me. So that's been really good. But I think the biggest thing was I was actually admitted to hospital for mental health, and I stayed a little while in the mental health board, and that was kind of a big wake-up call that I need to do better. So going from there in my absolute lowest to now, it's been a big journey, a lot of self-awareness, which always isn't the easiest thing, but that's been the biggest game changer, to be like, oh, okay, like, what is it I'm doing good? What am I doing not so great? And where can I improve? And doing things like the Circle of Security course has been absolutely eye-opening too. And looking into a lot of facets of my life and why I have certain thoughts and reactions to things that I do have. But yeah, and it's just kind of putting things, I guess, into perspective. Like I said, I used to get so caught up in like some small things, like the house is messy, or I haven't done this, or the laundry needs folding, or I need to do all these things and I need to do them perfectly and then to appear perfect and I've got this all under control and I'm a great mum. Like realizing that that's adding so much pressure to me and I don't need to have that pressure has been really eye-opening. I said this to you on our phone call earlier, like a good analogy that I have is that things in life are like balls, and some of these balls are rubber, so if you drop them they'll bounce. So if I don't fold the laundry, it's not a life or death situation, it'll just bounce. It'll be there at the end of the day, it'll be there next week, it's not going to change, you know, like
no.
That's fine. But things like my children and my husband, they're glass balls. If I drop them, they'll break. So I need to catch them. So they're a priority. And things like laundry or making my bed every day or, you know, having the latest clothes or things like that. Like even uni's, if I fail it, like I can go back and do it. It's not the end of the world. I'd rather not, but, you know, I need to put things into perspective. It's not life or death. You know, and that's, for me, that's the best way to view things. And that's what helps me. But I always catch my husband and my 2 kids, those balls, like, because like I said, they're glass balls and everything else will bounce if I drop it. So it's about putting things like that into perspective and realizing, like, it's okay. Everything is okay, you know, and where to put my energy.
That's right. And something I just want to come back on is when it comes to mental health, like you said, you know, after you went to the acute mental health, you said, oh, I needed to do better. And sometimes, like, it's not about you need to do better. Sometimes it's about you need help. You need, you know, you need medication or you need guidance, because if you don't know how to get better, you can't get better. You're not going to magically say, oh, today I'm going to feel better. Yes. No, that doesn't happen. You need help. And that's it's so sad that in your case, you were not diagnosed with postpartum depression when you obviously needed the help. That is like, and even when they did the test and they can see you scoring low, I don't know how they missed that, because it's really, like, it's so important to refer moms, because when you're living in it, sometimes you don't know that what you're living is not everyone else's reality. Sometimes you're like, well, maybe that's how everyone feels, that's how everyone is, so I'm normal. But you don't know that you need help, or, you know, or what you're feeling is not the norm, if that makes sense. And if you don't know, you can't seek help, you know. So you need someone to say, oh, actually, it looks like maybe if you saw, you know, a counselor or a psychologist that could help you to deal with these emotions, or to help unload that or unpack this. And then from there you go, the way I felt, now I feel so much different, but I didn't know that I needed that help. Actually, you know, I wasn't going to realize that one morning magically I needed guidance to get there.
Exactly. Like, I wasn't me in that time. So, And I didn't realize that, like, it just becomes so kind of hazy.
Yeah.
The point of where you are and where the mental health is, like, you kind of lose yourself in it. And I heard a statistic the other day that the biggest cause of death postpartum mums is suicide. So the fact that it wasn't picked up sooner, it's really quite sad.
Yeah, definitely.
So,
is,
yeah. And my husband likes to say, just let it go. Let it go. Let things go. And I was saying that to the counsellor, and she's like, but how? How do you let it go? That's just not a thing. And I'm like, oh, you're right. Like, the more you think about it, you just can't let things go. And it's about learning how to cope, pretty much.
Yeah.
So it's about strategies and about what strategies work for you. Like I said, like, sometimes putting things in a life or death basket for me, that's what helps me kind of see the bigger picture of things and kind of work forward, basically, and seeing things for what they are. So she pointed out to me that she drew circles on a whiteboard. So the middle circle was was basically me. Then a tight circle around that was my husband and children. And then she kept drawing circles around those so that it got bigger and bigger. And I was letting opinions and thoughts of people who were basically on the outermost circle affect me in the middle. And she's like, you can't let that happen. It's only what's in these tight circles around you that should be affecting you, not the opinions of people all the way out there. So society, what the internet says, what some blogger says on Instagram, I don't know, you know what I mean? Like, with her beautiful beige family, like, I shouldn't be letting it affect me and how I operate with my husband and two children. So that was a big kind of wake up to me, that I was letting all these things affect me, and they don't need to. So kind of and like I said, medication medication's been one of the biggest things to really help, and that is I'm truly grateful that I'm able to have access to that as well. So that's really good.
Oh, that's amazing. See, I'm so glad now that, you know, you're feeling better and you're feeling yourself. And as you said, you can realize that, you know, societal pressure, you can just push it aside and go, sure, I don't want to do this. That's not for me. I don't need to listen to you. I don't need to do what you're telling me. But you don't know what you don't know. So when you don't know that as a first-time mom, then you go, oh, I need to do this. I need to do that. It needs to work for me, when it's clearly not working. But you don't know what you don't know.
That's it. And when you have conversations with, like, other mums, and they're like, oh, I just love being a mum, and this is such a rewarding experience, and I just couldn't think of anything better in life, and it's going so well. And I'm like, well, that's great. If they truly feel like that, then that's all the power to them. Love that for you. But I need someone I can complain to, like, you know, I need someone I can vent to, like, this is really hard. And it is, like, being a mum is one of the hardest things I've ever done, but it doesn't take away from the fact that I love my children more than anything. So I just needed to understand, like, hey, I can have these people in my life as, I guess, periphery friends, but that's nothing more than that. You know, I can't have deep and meaningful conversations with these people, because it's just going to affect me and my mental health and how I view myself as a mother, because I don't enjoy every minute of every day with my children. I'm sorry. I just don't.
That's all right.
There's some hard times, like when my daughter's screaming at me, she doesn't want to put a nappy on, and then she wants Cocomelon on the TV. Like, I'm not enjoying that moment. I'm sorry.
No, you wouldn't be. Who would be enjoying that moment?
No.
Like, no one.
No one. And I'm sorry, like, my children don't wear beige clothes. So, all those beige mums out there, no offense to you, but oh my goodness. She wants to wear Peppa Pig and bright pink and a tutu dress. Like,
cool.
I'm going to let her. So, yeah.
Yes, sounds good. Yeah, and what works for your family might not work for your neighbour's family. I don't know.
Exactly.
You do your thing and everyone else does their thing. And the problem with social media now is we feel like we have to share everything we do, obviously the good side, not the rest. And then it's almost like then you see other people doing better than you, obviously with lots of brackets there, and you go, oh, they're doing so much better. I'm not smiling at 8 a.m, My daughter isn't dressed at 8 in the morning. And then you feel like you have to be like them, but you don't. And that's something really important to realize. Everything you see on social media is one photo of one moment that may not have even happened at that moment. And their reality is different from yours, and that's okay because they have different circumstances. They don't live the same life. They don't have the same parenting style, and that's okay. That's how it is. Every children is different, so you adapt to the child and you parent them the way you feel is right for them, and that's how it is, and that's the most acceptable way to parent, in my opinion.
Yeah, exactly. I couldn't have said it better. Like, these pressures that social media give us are just so unrealistic, and like you said, it's one moment from how many hours are in a day, you know, like, show me 3 in the morning when your child won't sleep. Like, that's what I want to see, because that's the reality of things. Like, that's what actually happens.
That's amazing. Well, thank you so much for coming on the podcast and telling, I feel like, what's everyone's reality that no one wants to talk about.
Yeah, that's it. Like, I hope to see more of it on social media, like the reality of things. But let's be honest, it's probably not going to go that way. But I hope that someone listening can take something from this and be like, oh, okay, like, it's not just me dealing with this. Like, it's every mum, basically. Yeah.
Exactly. Yeah, and that's it. That's why I do the podcast. It's so other people can go, oh, I'm not the only one. Thank goodness.
Yeah, there's nothing more isolating than feeling like you're the only one going through something, and it's just not the reality. Yeah,
we're probably all going through the same things, but we don't talk about it, but we need to talk about it, and this is what we're doing, and this is what we've done today. Definitely covered a lot of things that are taboo, so to speak.
Yeah, like mental health and not enjoying every moment with their children. My goodness, how dare I?
A lot of people will never admit to that. Like, that's it. That's something they'll never say, and yet there's no way they're enjoying every single second of every single day. Maybe they are.
Such a lie. Look, if they are, and I'd love to know how they do it.
Exactly. Tell us your secret, please. Well, thank you so much, Ebony, and I hope you have a great day and you enjoy yourself.
Will do. Thank you so much.
Thank you for listening, and I hope you enjoyed this episode. If you want to get notified of when a new episode comes out, please subscribe to this show on your podcast listening platform. Also, I would really appreciate it if you could leave me a review on Apple Podcast or share this episode so that other moms can find it. If you would like to tell your own pregnancy, birth, or parenting story, please head to the show notes and you will find a form there to get in touch with me. Again, thank you so much for listening, and I will be with you again next week for a new episode.